I'm Kayla, I'm 16, and I'm going to be a senior at Camp Place.
Were you worried about friends or
Um, from the beginning in March, I was initially not that concerned. I was just like, oh, this is just a virus. I'm young. It will pass over. And then I think like when you started like texting me about that stuff, I was like, wait a minute, that might actually be concerning. And then like as more cases came up, I was like, okay, I actually need to care about like other people's well-being. I can't just, because before that I was like doing regular stuff. Like I went to like this giant conference thing before all this happened. And then afterwards I got really sick from that, so that might have been like a good lesson or like a sign from the universe or something.
Can you share any stories you had about quarantine or how that impacted your health and life?
Okay, so like I said, I went to a conference before all this, and then afterwards I got really sick. I had all the symptoms of COVID-19. I didn't get tested for it, so maybe I had it, maybe I didn't have it, but that was a big wake-up sign, because if like you have to go through all of that and like, be scared of what you're going through and that there's no like medication to help you, it's scary. And like, you don't want other people to go through that. Regarding health, I think my mental health definitely took a very bad turn during quarantine, mostly because I couldn't see anyone, and also online classes. Like I just fell into like a really bad depression. I fell behind in everything, and yeah, it was difficult to, stay positive about it.
How do you notice people's privilege regarding COVID-19, even in your own circles?
Definitely privilege about class, and like about the outlook of it. Like some people, I think there's this one tweet where it's like COVID-19 is just a learning experience, and then it's difficult. Like if you're middle class or upper class, yeah, it's just like a time to stay home. But if you're in a poor community, that means like you might not be able to get food on the table that often. Like before this, I volunteered at a food pantry, and they talked about, well, if COVID-19 closes down the schools, which inevitably happened, we're gonna have to make lunches for the kids who are on the meal plan. And that really opened my eyes to like, oh, it's not some vacation. It's actually gonna like affect people, and people are gonna like, they're gonna be unemployed, and they might not get a source of income, and they might not get like basic necessities.
What about now as we come out of the first wave?
Now, after the first wave, it's definitely concerning, I guess, seeing how many people are not social distancing. Mostly because, like, the communities that are at risk still are at risk, and they're not going to go away anytime soon. So, poor people are still at risk, immunocompromised people are still at risk. Everyone's, like, still at risk. It's still a big deal for them. And, I saw this story of, like, this guy who thought he was okay. He went to a barbecue out with friends. A day later, or a couple weeks later, he got really sick. He posted on his Facebook, please stay inside. And then a day later, he died. So, like, that's horrifying. It could happen to anyone. And, you don't want to go through that.
Why are you so concerned when you see people breaking social distancing rules on Instagram or just in general now in New Jersey?
First, it's mostly because of their own health. Like, like I said, COVID-19 can affect anyone. So, even if you're perfectly healthy, you can still die from it. And that's something I'm worried about. The second thing is, like, worried about other people they could be putting at risk. And, what people from those vulnerable communities are they putting at risk? And what's the price they'll have to pay for that? And finally, like, it's also, like, what will we have for the future? Like, when will everything, like, officially open back up?
If someone were to rebut that and say, oh, but cases are going down, well, it's just a few friends hanging out, what would you say to that?
That one, sometimes I've kind of changed my mind about it. Like 2 or 3 people hanging out is okay, but like even if it's a small group of friends, they're still gonna have contact with their families, and they're gonna have contact with other people. It's just gonna spread. And even though cases are going down, like I said, there's no vaccine yet, and you don't want to overwhelm the healthcare system at once, and you want to keep those people in mind, because first responders are still hard at work doing all that stuff.
What do you want to see happen as we go into the summer?
Definitely want to see people having fun, but I also want to see people staying safe and, like, keeping in mind about other people and what they may be going through. because, you know, it hasn't ended yet. And just because it's not as relevant anymore doesn't mean that it's any less dangerous or, you know, difficult for people to deal with that.